Sleep paralysis are people living their nightmares. Sleep paralysis is a sleep condition characterized by temporary loss of muscle control, also known as muscle atonia, at sleep onset or upon wakening. While individuals are conscious of their surroundings and can open their eyes, they are unable to move or speak. Sleep researchers believe that sleep paralysis reflects the individual's inability to move smoothly through the stages of sleep, particularly during REM sleep. It is further classified as the REM parasomnia due to the abnormal sleep behavior that is likely occurring during the REM cycle. Symptoms of sleep paralysis include an inability to move or speak, a perceived sense of suffocation, oftentimes feeling a pressure on the chest and throat, hallucinations, most commonly with the perception of a dangerous entity or person that is in the room with them. In fact, 75% of sleep paralysis episodes involve hallucinations. As well, there is the sensation of floating or drifting in space, the sense of time distortion, and rapid heartbeat. While it is an abnormal phenomenon overall, it has a surprisingly high prevalence rate. Recent longitudinal studies found a 7.6 lifetime prevalence in the general population, affecting more students with 28.3% and psychiatric patients at 31.9%. On average, sleep paralysis episodes last for about 6 minutes. However, while it is considered a benign phenomenon on its own, with no known permanent physical consequences, there's often quite a lot of psychological stress that surrounds sleep paralysis. One study showed that out of 635 college students who experienced sleep paralysis in Japan, 60% reported feelings of anxiety and terror. For such individuals, the combination of experiencing paralysis coupled with hallucinations creates a feeling of real vulnerability and helplessness. How can we explain this complex abnormal phenomenon? Well, the direct cause is not entirely clear and may in fact be a result of many factors. Researchers believe that sleep paralysis reflects a disturbance with one's REM sleep, as paralysis most often occurs when people are falling into or coming out of REM sleep. It is during REM sleep that we often experience our most vivid dreams. When we are in such a state, our brain sends a signal to inhibit the motor neurons to create muscle atonia. This immobility is likely so that we don't act out our dreams unconsciously. Normally, muscle atonia ends when waking up, therefore a person isn't conscious of this inability to move during the REM stage of sleep. Ultimately, with this in mind, sleep paralysis is thought to involve REM atonia that persists into wakefulness, and those who are experiencing hallucinations are likely having the dream content from REM sleep persist into their wakefulness as well. An interesting study at the University of Toronto identified the potential neurotransmitters responsible for sleep paralysis. In the study, they measured the electrical activity in the facial muscles of rats experiencing sleep paralysis. They found specifically that GABA and glycine were responsible for inhibiting motor neurons during REM sleep, and it triggered sleep paralysis in rats. In effect, they were able to block the effect of sleep paralysis in rats once they block the receptors for GABA and glycine. While much more research is needed, this provides a hopeful start in developing treatments for sleep-related motor disorders. There are also other potential triggers to sleep paralysis. One study showed that there may be a high correlation between sleep paralysis and anxiety disorders. Namely, they found that 31.3% of patients experiencing frequent weekly episodes of sleep paralysis also met the criteria for an anxiety disorder. Ultimately, they concluded that feelings of stress, fear, and anxiety may be predisposing factors that make the occurrence of paralysis episodes more likely to occur in the future. As well, a lack of sleep, disrupted sleep schedule, substance abuse, and sleeping position, namely sleeping on one's back, can also influence the likelihood that one will have these episodes. The simple answer to the treatment of sleep paralysis is ultimately to improve sleep hygiene by maintaining a regular sleep schedule and by creating a relaxing bedtime routine. However, considering the nature of sleep paralysis, it can be much more nuanced than just that. There may be underlying sleep or medical conditions such as narcolepsy, insomnia, nightmare disorder that may need to also be tested to get proper treatment. as well as managing stress and anxiety, avoiding stimulants and alcohol, and changing